Traumatic facial injuries usually occur when you least expect them. Regardless of what caused your injury, an oral and maxillofacial surgeon is highly qualified to restore your oral and facial function. I have completed a rigorous hospital-based surgical residency and received significant experience in treating traumatic facial injuries. Oral and maxillofacial surgeons are busy members of emergency room teams and are called on to treat a wide range of injuries involving the face and the neck. Our experience allows us to properly treat broken facial and jaw bones and oversee the healing process to ensure optimal facial function and aesthetics. Training and working in a hospital setting has taught us that there is an art and a science in dealing with these injuries, and we want all our patients to have the best outcome possible. We understand how critical it is to address traumatic facial injuries quickly and will do all we can to accommodate you when you contact our practice.